Hey there. Have you been suffering from back pain lately? You know, back pain can actually come from all the way up at the top of your back, way down, and actually go all the way down to your knees. Since 1989, I've been working with thousands of clients who have back pain, and I've been studying back pain and what actually causes the problem. The biggest problem is that when people have pain, they immediately go and they rub the site of the pain. So you're rubbing your low back, but the problem's not coming from your low back. The analogy I like to use is if you pull your hair at the end, it hurts at your scalp, but rubbing your scalp, taking aspirin, or having brain surgery is not going to work. You just have to let go of your hair. Well, it's the same thing with back pain. You're feeling it in your back, but it's coming from muscles that may be far from your back. So you need to be looking at the source of the pain and not just rubbing on the symptom. There are 4 muscles that cause a long list of aches and pains. I call them the hidden muscles because 3 of them are deep inside the body and 1 of them is right there on the front of your thigh. But most people aren't aware of these muscles. When they're tight, they may cause low back pain, hip pain, sciatica or sacroiliac joint pain, knee pain, or even tight hamstrings. Many times people are having pain that can wake them up in the middle of the night or make them stop short during the day, and it gets worse when they try to stretch. Treating some muscle pains can seem impossible, even when we try massages, physical therapy, muscle relaxers, or pain pills. You know, when we don't understand something, it can become so frustrating, and the body is complicated, so it's easy to get frustrated, especially with these 3 muscles that cause back pain. So, with my friend Max, we're going to go into the other room, and with the power of editing, the first muscle is called the psoas. The psoas originates along the front side of the low back vertebra. These are called the lumbar vertebra. And it goes straight down and inserts into the inside of the thigh bone, close to your pubic bone. The second muscle is the iliacus. The iliacus originates along the entire inside curve of Max's pelvis and inserts into the inside of his thigh bone at the exact same place as the psoas. When the iliacus contracts, Max will lift up his leg to sit down or to climb a flight of stairs. The 2 muscles merge together and they're called the iliopsoas. The iliopsoas inserts on the inside of the thigh bone. These muscles contract when we walk, sit, or if you're sleeping on your side with your legs bent. In fact, the only time the muscles are not contracted is when we're standing straight and still, and that's rare. So when you think about it, the muscles are contracted 90% of the time, and that causes the problem. There's a phenomenon that's called muscle memory. And what muscle memory says is when a muscle is shortened for a period of time, it actually changes length to that now shortened position. For example, I've been sitting here now for about 2 hours, and the iliacus and the psoas muscles have both shortened, and I'm starting to feel a little bit stiff. And you may have felt that when you've been sitting at your computer or maybe playing video games for a long period of time or riding your bike for a long period of time or maybe even running a marathon. But let's go into a larger room where we have more space, and we're going to use Max and me and some graphics to be able to explain this whole situation to you. So I'm going to be exaggerating this a bit to make it clear, and we're going to use a little piece of red ribbon, and that'll help also. The psoas muscle originates up here at the top of the lumbar vertebra, and it comes straight down and it inserts into the top of the thigh bone. When the muscle contracts normally, the psoas muscle in the lumbar will cause you to lean forward, and the iliacus muscle here on the inside of the pelvis picks up your leg. But let's just say that you've been sitting. So you see what's happening to the psoas. It's getting loose and baggy. And the same thing is happening with the iliacus. And it inserts here on his thigh bone. The problem is, when you go to sit down, you can see what's happening to the muscle. It's becoming long. So the body shortens it so that you'd be able to sit. But then you go to stand up, and now the muscle's too short. So watch my thumb, and you'll see. As you go to stand up, the muscle is too short to make the go. So it pulls down on your lumbar vertebra, and it's putting a strain on the lumbar vertebra, putting a strain on the pelvis, rotating the both of them forward and down, and you have back pain. Now, you can imagine that the lumbar is following the muscle down. So you try to stand up straight, except you can't. That can be happening when you're sitting at a desk, or perhaps if you're a cyclist and you've been cycling, and you try to stand up and you can't get all the way straight, so you kind of move around a little bit and you're hurting, and eventually you stand up straight. And it's all happening because the psoas muscle and the iliacus muscle have both shortened. So now the third hidden muscle is called quadratus lumborum. The nickname is QL for short. It originates here on the top of the pelvis, comes up the lumbar vertebra, inserts here on the 12th rib. The nickname for this muscle is called the hip hiker because when it contracts, it picks up your hip so that you can move your leg easily. Problem is, because of your pelvis coming down in the front, it's going up in the back, causes the QL to be too long to do its job, so the body ties a knot right here at the 12th rib. And that's now holding your pelvis up in the front. So if you think about it, you have the psoas pulling down your lumbar, the iliacus pulling down your pelvis, rectus femoris in a knot holding the two of those down, and now you have quadratus lumborum holding your pelvis up in the back. So the whole thing has rotated. A big problem that happens here is as that's going on, this is called, right here is called the greatest sciatic notch. And your sciatic nerve comes through that notch. There's your sciatic nerve. And if you think about the whole anatomy here, as the pelvis is coming down, this part is going up, which means this bone right here is pressing directly into your sciatic nerve. And so you're getting really wicked sciatica, and it's caused by this bone pressing into your nerve, but that's caused by these muscles pulling your pelvis down in the front. So you're feeling it in the back, but the cause of it is here in the front. And finally, right here is your sacroiliac joint. And the sacroiliac joint is not supposed to move at all. It's a permanent joint. But because of the psoas pulling down on the lumbar, it causes your sacrum to pop up. And it causes a spin right here on the SI joint. And the pelvis coming down is causing a separation at the SI joint. So you have the SI joint being turned and pulled. You have horrible pain all across here, but it's all being caused by these muscles in the front. So I'm happy to say there is a solution. I've worked with so many people through the years, and I've taught them this whole explanation of what was going on, and then I would teach them self-treatments that they could be doing so that they can get rid of it, because it does need to be done every single day for at least a week. And they asked me to put it in a book, so I did put it in a book. And the title is The 15-Minute Back Pain Solution, and it's a step-by-step guide, 15 minutes a day for a week, and you treat each muscle in the proper order that it needs to be done. The book is available on Amazon as a Kindle book, and it's also available on my website as a printed book. So it's worked for so many thousands of people. I truly believe it'll work for you. Thank you.